Welcome everyone to our program. Tonight's program is COVID Update with Dr. Goodfriend. My name is Susan Van Epps and I work for Loudoun County Public Library, and I'll be your host tonight. Tonight we're going to take questions from the audience using the chat box feature. You can see the chat box feature in the bottom right corner of your screen. If you click on it, you should be able to send questions tonight through that feature, and then they will be routed to me a little bit later in the program. And I did just put a little message there to say welcome everybody, to help you recognize where the chat box feature is. Now it's my pleasure to introduce our speaker for tonight, Dr. Goodfriend. Welcome back. Nice to see you again.
Thank you.
Dr. Goodfriend is, as those of you may know, he's a board certified physician with over 30 years of experience, and he is the director of the Loudoun County Health Department. So welcome, Dr. Goodfriend. You have been guiding us through this pandemic now for a year and a half, and you were with us for a library program about 7 months ago. It seems like it was longer than that. It's hard to believe it's only been 7 months since that last program. But I have a bunch of questions for you, so I'll go ahead and get started with my questions, and then we'll take some audience questions a little bit later.
Great.
So my first question is, I know that the Virginia Department of Health and the Loudoun County Health Department has seemed to really work hard to keep updated information out on the websites throughout the pandemic. So I wanted to read back some data that I recently pulled, and then I have a question related to it. So now here we are, a year and a half into the pandemic, and in Loudoun County, it seems that we have had, at last count, 32,793 cases of COVID. And while most of those people have recovered, 1,168 had to be hospitalized, and 291 people, which represents about a quarter of the people who were hospitalized, did not survive. So my first question is, what are the current demographics and who's being hospitalized and who is not surviving? And how has this changed since the pandemic began in 2020?
It's changed significantly since vaccine came about. So last winter, predominantly the folks who were getting hospitalized and dying were our seniors and those with medical problems. Right now, our hospitals are doing pretty well, even though we are seeing a good number of cases. We're averaging about 70 cases a day. We were up to about 90 something cases a day just a couple weeks ago. But the large majority of those are pretty mild in symptoms. And the main reason for that is the high-risk folks have done a really good job of getting vaccinated. And while through the Delta variant, vaccination doesn't mean that you can't get infected, the likelihood that you will get a serious infection goes down dramatically. So right now, there's been a significant shift in the cases that we're seeing from the seniors, high-risk folks, down to those under age 12, who represent a much more significant number of cases because they're not yet able to get vaccinated. We still do get a number of folks at higher age groups, one, because not everyone has gotten vaccinated, and really we do want everyone to get vaccinated, but also with the Delta variant, there are breakthrough infections.
Sure, you mentioned the Delta variant. I was going to ask, is that now the predominant strain in Loudoun County? And if it is, are you noticing any differences in the symptoms that it's presenting with as opposed to the earlier variants?
By far, it's the predominant variant in Loudoun County and Virginia and throughout the United States. It's just so contagious. And really, that's the challenge with people, people who are not yet vaccinated, people who are household members of them, because we're seeing a lot of the breakthrough cases in people who have very significant contact with unvaccinated people. So you know, family members who've been vaccinated, but they have a young child who hasn't yet gotten vaccinated, really are at risk of getting infected as well, even if they've been vaccinated. And the symptoms, because of that, tend to be pretty benign. So for a lot of our vaccinated people, again, they may not know they have symptoms, or it's just very mild respiratory symptoms. Fortunately, that's what we're seeing in Loudoun County. In many parts of Virginia and in the country, their emergency departments and hospital beds are being overwhelmed because their vaccination rates are not as high as what we're seeing here.
Well, at least that's one good thing for Loudoun County. That's good to hear. You mentioned the vaccination rate is high among the high-risk population in Loudoun County. Can you give us just kind of an update on where we stand for the vaccinated rate for adults in Loudoun County, and then also for teens ages 12 to 15? I'm sorry, 12 to 17.
About a little over 80% of our adult population is vaccinated, which again is very good, but not as good as it could be. And it's fairly similar with the 12 to 17-year-olds. We're seeing about 70% or more. We do see areas where vaccination rates are not as high. Our Western Loudoun County vaccination rates are not as high. And also amongst our Spanish-speaking immigrants, the vaccinations are not as high. So we're trying our best to do outreach, particularly for these two communities, and make it as easy as possible for them to get vaccinated.
Terrific. Okay. Now that we've vaccinated such a high percentage of people, I wondered if you have any data on the recorded safety and reaction rate from the vaccinations that have been given in Loudoun County in either of those groups that you mentioned, the adults and then the teens.
The adverse event data is not collected on a local basis, but what we know overall is the vaccines are very safe and very effective. Now, there are challenges with some of the vaccines, and particularly we've seen issues with younger males and having heart inflammation that's in general self-limited, but it's a concern and something that we look out for. But in general, it's a very well tolerated vaccine. By far, what the symptoms people have from as a result of the vaccine are what people tend to get with a flu shot. Flu-like symptoms, achiness, tiredness, more after the second dose than after the first.
Okay. Very good. So I read recently, I think it was back in mid-September, that Pfizer had submitted some information to the FDA based on their trials of COVID vaccines among thousands of children ages 5 to 11. And they also announced that they're going to have data on two other groups, the younger toddlers ages 6 months up to 2 years, and then those ages 2 to 4. They'll have data on those by the end of the calendar year. So I was just wondering, based on that information that came out from Pfizer and any other information that you have, do you have estimates for when vaccines might be available for those groups here in Loudoun County?
Yeah, well, so recently the FDA and the CDC approved and recommended booster shots for Pfizer. And so those are now in place. And definitely if anyone has gotten vaccinated more than 6 months ago and completed their vaccination series with Pfizer and are in a high-risk group, we would recommend that they get vaccinated. We expect within the next couple weeks the same approvals to come forward for Moderna and for Johnson & Johnson. And then the FDA is due to meet towards the end of this month to look at the 5 to 11 age group. And that's going to be very important. We hope that by the first week in November, we'll be able to start vaccinating that age group. And it is so critical because those are our elementary school kids. And if we want to keep our kids in school, that's the population we really have to hit. The younger kids, probably not until after the start of the new year will they come forward to the FDA.
Okay, great. That kind of leads in. I will have some more questions about boosters coming up in just a second, but I did want to ask a question about the school system and kids. We've had classes underway now for a little over a month, and there's been 80,000 kids in the school. And at last report, they have about 144 students with active COVID and 13 staff, and about 260 in quarantine. So I was wondering, how has the cumulative caseload been in the school system versus where you thought it might be? And are you seeing any trends in how the students are getting infected? Is it a certain location? Like, is it their clubs? Is it their sports? Is it just being in the classroom together? Do you have any information about that?
Yeah, the Delta variant has made it a lot more challenging to be in school. So fortunately, we're not seeing much in our secondary schools because of our vaccination rates. But still, there are breakthrough cases, and not everybody is vaccinated. Most of what we're seeing are really in those under age 12. And within that, we see a variety of issues. Some are just people who got infected outside the school, and that's the majority of them, and happen to be school age. So they get counted as being in isolation, but there was no transmission within the school. But the challenge is we know there's value in kids being in school. We learned that very starkly last year when the schools closed down. So it it is balancing that risk of having COVID in the school with the risk of for kids of not having school to attend. And so with that, with the Delta variant, we expected there'd be cases. Really, the challenge is how do we minimize the transmission within the school when you do get a case? And it's very difficult, on buses where it's hard to keep 3-foot distancing, and then also in the classroom where it's similarly hard to keep that distance.
Okay, thank you. I do have a few more questions about boosters. I've also got some coming in through the chat, so I'll go ahead and kick off with this one. You mentioned that the boosters available currently with the Pfizer vaccine, and you mentioned that you think it'll be coming for Moderna and J&J, but I didn't catch when you said that would be. You think that'll be before the end of the calendar year, or?
It should. So the boosters for Moderna and J&J, assuming that the FDA authorizes it, should be by the end of this month.
Oh, by the end of this month, okay.
But it all depends on the data that they've received from the companies. It may be that they don't think the data supports boosters. And that could either be because the data is weak and the studies weren't done right, or because the vaccines are so good that they don't need boosters. But they are looking to evaluate it in the next couple of weeks. And typically about a week after they do their evaluation, it goes to the CDC for their recommendation. I do want to step back with the discussion with the schools because it is so critical. And vaccine really is the #1 way that we can keep our kids safe and keep them in schools. But as we talked about before, there are breakthrough cases even in the fully vaccinated students and staff. And then we have so many kids that just are not old enough to get vaccinated yet. So mask use is critical. If any children are having any symptoms at all or have high-risk contacts, keep them home, get them tested so that they're not risking transmitting it to others. And similarly for team sports in school and club sports, there really is, there's no value in sending a kid to either of those if potentially they're sick, because all it does is quarantine the team. So it's a multi-layered approach that we really rely on folks to follow to keep our kids safe and keep them in school. And while we talk a lot about our public schools, we have a lot of private schools as well. So we do encourage all of our private schools to follow those same steps of encouraging vaccination and really being strict with mask usage and quarantining kids who are close contacts.
Absolutely. Okay. And let's see, I guess I'll jump back to boosters for a second. Just because you mentioned it a couple of times, the 6-month time frame. Is that the recommended time frame that we'll be looking for in Loudoun County for someone to be eligible for a booster, is 6 months after their second vaccination shot?
Correct. And we're providing booster shots right now. So anybody, if it's been more than 6 months since your last Pfizer dose, so you have had to have had 2 Pfizer doses. If you had Pfizer and Moderna, it's not yet recommended to have a booster, but hopefully we'll have an answer by the end of this month for those folks. But if you had 2 Pfizer doses and your last Pfizer dose was more than 6 months ago, and particularly if you are in a high-risk group, you can get a booster shot now at any local pharmacy or at our Dulles Town Center location.
Okay. I have 2 kind of related questions, one from the audience and one that I had, which is, if someone was fully vaccinated and maybe they're not yet eligible because it hasn't been a full 6 months, or they got Moderna or J&J and they're not eligible for a booster because of that yet, should they be nervous about going out in the public that they're going to come down with a serious case of COVID because they haven't had a booster shot? And then the second question, which is related to that, is what would their protection rate be right now, assuming that they had their original 2 shots 5 months ago, 6 months ago, but they haven't gotten a booster yet?
Yeah, and there's nothing magic about the 6 months, but the studies did show that after 6 months, they started seeing the protection starting to go down slowly. So it's not like an expiration date where after 6 months, the vaccine is not helping you at all. It still will be very significantly beneficial. So even, it's been more than 6 months for me since I got my last Pfizer, I haven't gone yet to get my booster. I will eventually, but I'm not in one of the high-risk medical groups. So I want to make sure that others have an opportunity. So it's, as I said before, if you're not yet due for a booster shot because it's not yet approved or it's not yet 6 months, yeah, that's fine. But just keep taking all the other steps you've been taking before. When you go to the market, wear a mask. Don't be around people who are coughing. Those are the main steps we can take. But we don't think that if you're 5 months into your booster, or you're 7 months from your primary, that it's going to be a significant difference. The main thing is getting your booster now or whenever you're eligible, so that going into the winter when we do think that transmission is going to go up, because this is a winter virus, that you'll be fully protected. So the typical thing we've been suggesting to folks is, if you're coming up on your time for a booster for COVID and you haven't yet gotten your flu shot, go to your local pharmacy or your doctor where you can get both at the same time. Because both are very important to get us through this winter safely, and both can have side effects to them. So it's a good thing to get both at the same time if you can.
Good plan. All right, very good. And yeah, I just wanted to ask you a really general question about booster shots, but I've heard it come up, which is, is it unusual for a vaccine to even require a booster shot? Does it mean that the original vaccination wasn't as effective as it should have been?
Well, many vaccines have boosters in one way or another. The most common one that we get is our tetanus booster every 10 years. But every year we need to get a new flu shot. And so we sort of take that as a given, that what we got last year is not going to really protect us a lot the following year. And it's similar to that in that we want everyone to be topped off at as much protection as possible as we're going through the pandemic. I think when we get through the pandemic, easily it may turn out that 80% protection is more than enough, because the flu shot, when we're lucky, gets about 60 to 70% protection. The COVID vaccine, after your second shot, is up in the 90+% protection, but it starts drifting down. And this really is just to get you topped off into the 90s again.
Okay, great, thank you. Okay, this next question may seem a little unusual, but I wanted to ask it because it did reflect something that I experienced out in the public last week. I met someone out in Loudoun County in a professional office who shared with me that she believes that the majority of cases of COVID that are happening right now are in the vaccinated population, not the unvaccinated population. And she believes strongly that the vaccine is not safe for children. I wondered if this is representative of a significant portion of our community, and if it is, what message you would want to send to those residents?
Well, we are seeing about 30% or so of cases in fully vaccinated people. But again, those are people who typically will have very mild symptoms. So as we learned with Delta, yes, a fully vaccinated person can get infected, but it's much more likely in unvaccinated people. So again, if you think about 80% of our adults are vaccinated and 30% of our cases are in vaccinated people, it is much more likely that it to occur in an unvaccinated person than in a vaccinated person. But hospitalizations and deaths are anywhere from 7 to 11 times more likely in unvaccinated people over vaccinated people. And that really is the critical piece. We want to reduce transmission, which is very important. But at the end of the day, as you mentioned, 291 Loudoun residents have died with COVID. And how do we keep that number from going up? And vaccination is the critical way of doing that. We also know that there are people who have been hesitant about the vaccine. When it first came out in December and January for adults, so were folks saying, well, this is new. I don't want to try it yet because it's a new vaccine. And we've learned in the last 9 months that it is a very safe and effective vaccine. But this is new for the 5 to 11-year-old population. So we understand that some folks may have some hesitancy with having their 5 to 11-year-olds vaccinated. For many folks in Loudoun County, they may have a 5 to 11-year-old, but they also have a 12 to 17-year-old. So very easily, some of the siblings have already been vaccinated. It's the exact same product in 5 to 11-year-olds that is used in older kids and adults. It's just they're giving a third the amount. So it's not any different than what those of us got. So we don't expect any different side effects. And as I said, the FDA will be looking at the side effect profile. It was one of the things, particularly when they were having their discussions with booster shots in young adults, is really balancing the risk of the vaccine with the benefit to the individual. We know that 5 to 11-year-olds are much less likely to die from the infection, but they do die. We just, unfortunately, a month or so ago in Fairfax, someone under the age of 12 died from COVID. And there have been a handful of folks, I think there were 2 in the Virginia Beach area recently that died.
Yeah.
So there is a risk even in that population. But before it will get authorized by the FDA, they'll look at that risk and then also the risk of the vaccine itself before they authorize its use in that age group.
That should be really, hopefully reassuring to parents. That's great. Thank you. So jumping back to boosters, I know that there's groups listed out on the Virginia Department of Health website about who is eligible for a booster, and it's the groups that we've heard about a lot, those over 65, those 50 to 64 with a number of medical conditions, and those medical conditions are all on the website, which I thought was great, listed out. Anyone in a long-term care setting, and then it listed 8 specific groups of workers who are eligible now for boosters because of their workplace environment. And it said that the list may be updated over time. So I'm wondering how this is going to be interpreted in Loudoun County when we are administering booster shots. Are you going to go strictly by those 8 worker groups, or will any other frontline workers who aren't specifically listed be allowed to get a booster within the 6-month time frame?
Well, typically these groups are ones that follow the initial rollout of the vaccine. So when the vaccine came out in late December and January, really we started with those over age 65, long-term care facilities, those with underlying medical conditions, and those in high-risk occupations. So they're the ones that are coming due for their booster shots about now anyway. From the county's perspective and Virginia Department of Health's perspective, essentially, we take people's word that they fit into one of those categories. No one's asked what their medical condition is. No one's asked what their occupation is. So as long as it's been at least 6 months since you had your second Pfizer dose, and you can self-attest that you're in one of those categories, we're happy to give you the booster.
Terrific. And just to reiterate, I know you mentioned it earlier, where you can get a booster. I now know you can get a COVID shot in 47 different places in Loudoun County, which is amazing. But where other than Safeway and the Dillestown Center location, are there any other places they can get a booster currently that you're aware of?
Almost all local pharmacies have the COVID vaccine. Many physicians' offices have it as well. And if you go to vaccines.gov, you can just type in your zip code and it'll show you every location near you that will have. And if you're looking for the Pfizer, then you just check off the Pfizer box.
Okay.
But again, we know that there are folks out there who have not yet gotten vaccinated. We also want them. And one ask I would have is, if someone is fully vaccinated and they know someone who's eligible but not yet vaccinated, take them with you to Dillestown Center. Get your booster, let them get their initial vaccine at the same time.
Great. Hopefully that'll help get some people there. I'll just remind everybody, if you have any questions for Dr. Goodfriend, please feel free to put it in the chat box and we will pass those questions along. Got a couple here. Do you have any advice for parents of young children in school? Well, you kind of touched on that already a little bit.
So really the key part is, if they're not yet vaccinated, are not able to get vaccinated, wear the mask in school. If they're not feeling well, let them, tell your parents you're not feeling well. Because again, nobody wants to be the kid that causes others to have to stay home and get quarantined. And then really keep your distance from folks. One of the challenges is as people going to the cafeteria, you can't wear a mask in the cafeteria. And people talk. So to the extent that you can keep a distance, the better. But those are the main things that we can all do as we get to the point, hopefully, just like for those of us on the call, where we were waiting until we were eligible for vaccine. Really, we're getting close to the point that 5 to 11-year-olds can get vaccines. Probably going to be a month to 6 weeks from now that'll be offered to that age group. How do we keep them safe until then?
Great. Okay, here's another good one. Are there any advantages to wearing masks outside at this point, or is being outside enough of an added protection?
Well, it doesn't hurt to wear a mask outdoors, but unless you're in a crowded space, it likely does not add significantly to you. So, there was a rock concert in Southwest Virginia, where I think a lot of the components were outdoors and people got sick. But in general, if you're keeping a distance from folks, then there's no need for a mask. One of the things to think about is, as we get close to Halloween, if we assume there are going to be some Halloween parades going on, if you're in a close quarters with other people standing on the side of the road, there may be value in wearing a mask if you're around the same people for more than 15 minutes at a time.
Okay. Any updated data on vaccines for pregnant women?
It's safe and effective for pregnant women. The CDC recently, just this week, came out urging pregnant women to get vaccinated. It's very similar to what we do every year with urging pregnant women to get their flu shots, because the risk of getting infected when you're pregnant and the subsequent risk of miscarriage is so much greater than any risk from the vaccine. So we definitely, like with most vaccines, you want to get your vaccines before you get pregnant. But if you haven't, then it's much safer to get vaccinated while you're pregnant than not.
Okay. Good definitive answer there. Are you seeing, you touched on this a little bit earlier too, are you seeing worse symptoms in children with the Delta variant than the earlier ones? Worse symptoms.
Yeah, I don't know if there's more or less with them. Really, it's mostly just that it's so contagious.
Yeah.
And so we went very quickly from about 3 cases a day to 30 to 50 cases a day once the Delta variant started coming into Loudoun County. And that's really its main concern. It's not that the symptoms are more likely to send a child to the hospital, just it's much more likely for that child to infect a lot of other people.
Okay, great. All right, final call for questions from the attendees. If anybody else has one, feel free to send it in. And one more question here. Dr. Goodfriend, would you plan a family Thanksgiving this year if everyone at your Thanksgiving dinner was vaccinated?
Yes, so definitely, actually just talking to my wife today, because we didn't have a Thanksgiving with family last year. But again, you think of, is everyone vaccinated? How do you keep your numbers small? Because even if folks are fully vaccinated, you still may have folks that are infected. In many of our families, we're going to have participants who are too young to get vaccinated, even by Thanksgiving. And so we keep that in mind as well. The other piece is travel, and travel by itself is a risk. So, trying to think through this in moderation, and particularly if there's any high-risk person who may be participating in that Thanksgiving holiday. So, grandma and grandpa, you still may not want them at Thanksgiving if you're going to have young kids who are not yet able to get vaccinated. So even if the grandparents are fully vaccinated, how do we keep that extra protection for them? But definitely much more we can do this year, whether it's trick-or-treating or Thanksgiving or Christmas parades than we were able to do last year because of the vaccine.
Okay. All right, one more question that's come in. When I'm out in places like grocery stores, I see lots of people without masks. Will my mask protect me from exposure from them?
Yeah, so ideally everyone would wear masks, but there's no requirement for mask usage. again, I see a lot of variability, just, anecdotally. Some places are much more likely to have people wearing masks. I see, like supermarkets are much more likely to see people in masks than home construction stores. And so you're wearing a mask helps. Everybody wearing a mask helps more. Keeping distances is even better. But the big thing is also being fully vaccinated. So I always wear a mask when I'm indoors, whether it's Costco or Giant or Lowe's, and then hopefully that will encourage others to do the same.
Okay, that sounds good. And last but not least, what kind of resources do we want to plug for people who maybe think of questions after tonight's program? They come up with a question about COVID. They need to ask someone who can give them a knowledgeable answer. What should they do?
We've had a hotline in place Monday through Friday, 8:30 to 5 throughout the COVID pandemic. That's 703-737-8300. Or folks can email the health department at health@loudoun.gov with any questions they have. There's also a great COVID website on the county's website. So I encourage folks to go there for the latest information. But really critically, it's, we all continue to need to do our part. Vaccinations, if we've been fully vaccinated, if it's time for a booster, consider a booster. Masks, distancing, staying home with sick, getting tested if we think we may have gotten exposed.
And one last thing, what are the hours at the Dulles location currently?
Well, currently it's by appointment only on Tuesdays, Fridays, and Saturdays, about half days each. But where the great value of Dulles Town Center, we can flex those hours to meet demand. So, well, if you go to our website, the county's COVID website, you can see the hours. Those easily are in flux as we see more folks coming in for booster shots. Because we can go 6 days a week, 8 to 10 hours a day if needed. And we would encourage folks, if they benefit from vaccine, please sign up for an appointment. Because that way we'll just add more appointments if we start filling up.
Okay, great. Oh, and what's your opinion of home test kits for COVID?
So home test kits, have an important role. In general, they're not as good as PCR tests, but we know that there's a challenge for folks to get into a doctor's office or to an urgent care to get a PCR test. So the county does offer drive-through PCR testing. And so encourage folks, if they're interested, again, go to our COVID website and it'll give the times and locations for free testing. But home testing has an important role for those who can't get in for those. And we have, just plugging one that we have in the health department, Lucira. One challenge is there's a shortage of home tests. But definitely they're a good screening test and they're better than nothing. So if you're having symptoms and you take the test, it really is helpful if it comes back positive. But again, we understand that there are challenges with getting tested and finding a place to get tested. Please take advantage of the county's testing opportunities. We tend to get about 250 to 300 people each time it's offered. And definitely it has the capacity to do more. And the more folks that get tested, the more we find, because we'll always find some people who, through that drive-through testing, who had no symptoms at all and just said, well, it was free, I'll give it a try. And we'll pick up some that otherwise would have put others at risk.
Fantastic. All right. Dr. Goodfriend, is there anything else you'd like to tell us that I didn't ask you?
Thank you for hosting this. Again, we encourage everybody to stay safe. If they haven't yet gotten vaccinated, please do. That really is our best protection and not only keeping our hospitals from getting overwhelmed, but keeping our kids in school. And if you're ready for a booster, if you meet the criteria for a booster, please feel free to do so. No urgency in getting your booster shot, but make an appointment, either a local pharmacy or Dulles Town Center. And then don't forget all those other steps that are so critical to keeping us safe: masks, distancing, testing, staying home when sick.
Okay, wonderful. Well, Dr. Goodfriend, thank you so much for your time on a late Friday evening. I appreciate it. Thank you for all of the good information. I want to thank the audience for turning out tonight to watch the interview, and let you know if you missed any part of what Dr. Goodfriend had to say. We did record the program, and we'll be putting it on our Loudoun County Public Library Programs YouTube page. So you can look for it there. That information is linked in our calendar at library.loudoun.gov. And again, the COVID-19 phone line, just in case you didn't see it in the chat box, is 703-737-8300 for any questions that you didn't think of tonight. So thank you very much and have a good evening. Thank you, Dr. Goodfriend, again, as always.
Thank you.
Take care.